most of the times it's not about the doctor, it's about the service that the staff gives to that patient.
Welcome back to another episode of Liz's Hustle and Heart podcast. I'm your host, Liz Rodriguez, and today we have a very special guest joining us, Dr. Moises Issa, the esteemed medical director of Family Medical Group and PMP. With decades of experience in healthcare, a passion for providing exceptional patient care, Dr. Issa is here to share his journey and insights into the world of medicine. So get ready for an inspiring conversation. Dr. Issa, welcome to Liz's Hustle and Heart podcast. Thank you for joining us.
No, thank you for having me. This is a great pleasure to be here in your podcast.
Thank you. I have a few questions to run down. Dr. Isa, can you share a bit about your journey into the medicine world?
One of the reasons why I went into medicine was because as a little kid, um, I had a neighbor who actually was a surgeon who invited me at the age of 14 to go to Palmetto Hospital, believe it or not, where one of your clinics is, and to see a surgery. And I actually loved it. And I thought that it was the most incredible thing how this person, it was an acute appendicitis, and the person was about to die because it had bursted, and I went in with him. I stood in a corner so I wouldn't bring fuel, and it was such a life changing experience. From that moment on, I was like, this is what I want to do. I want to become a doctor. Initially, I wanted to become a surgeon,
Oh, wow.
and I did a 1 year of surgery. But after that 1 year in Baltimore of doing shock trauma, I decided to go into internal medicine.
Amazing. That was my next question about your specialty. Okay.
The trauma of surgery actually drove me into internal medicine.
Okay. Okay. How did you get involved with us at FMG?
So one of the things that I loved about your group, when I first met you, I met you in the at our clinic in Kendall,
Yeah,
your clinic in
I
Kendall,
remember.
and I came in with Dr. Goldfarb, and we were talking to you about research because I do clinical research. And one of the things that you had, you were you were micromanaging, and you were delegating a lot. Your infrastructure was in place. Um, your staff was on point, and I thought, gee, you know what? This is a great place not only to bring the accidents, which is something that you've done and you
Mm.
do well. But if you're doing that well, you could do medicine, or what you guys call major med, what we call medicine,
Yeah,
general medicine, and offer it. And
right.
that's a very underserved area. You're in great locations. You have locations everywhere in Miami where uh, most of these people need good doctors and good clinics. Most of the times, it's not about the doctor. It's about the service that the staff gives to that patient, making them feel at home. And I think you at Family Medical Group do an amazing job at doing that for accidents. I know you could do it in medicine
Yeah,
too.
I'm excited to take on the whole major med, as we call it, or medicine, as you call it. I'm really excited to be guided by you and for you to be one of my mentors. And, the partnering up or the collaboration is excellent for us. We've been for years trying to propel forward in the medicine world. I just haven't been able to do so as successfully as accident rehabilitation. But over the last year, I've had great guidance, and now you've come into our world. So I just hope to really expand and go from not only primary care to multi specialties, because I do know that that's what you have in your centers as well. And hopefully we can do that together.
Absolutely. And I think that you do have the infrastructure, you have the drive, you're a hard worker, and you have a great team around you. The one thing with general medicine, it just takes a little bit of time, as you know.
Yeah.
It's not as snap your fingers and it happens. Um, so their insurance companies tend to move a little slower to
Mhm.
credential people. They vet people a little more stringent
Right.
than other industries. So yeah, it takes a while, but once patients get to know you, and when patients see the customer service and how well your staff is, they're gonna love it.
I couldn't agree more. One of the things that a lot of patients do ask us is, do you accept my insurance? The community will ask, how come you don't take XYZ contracts? And they don't know the hardship it takes to actually be accepted, approved, vetted, like you said, into these contracts. So I do believe in the last few years we've been able to get into a few panels. Thankfully, with you as well, you've opened a lot of the doors. So we're super excited for open enrollment that's coming up because of this. Can you elaborate a little bit more on open enrollment that's coming up?
Yeah, definitely. Open enrollment AEP began about 15 years ago, and the thing about the AEP is that, or open, what we call open enrollment, is that patients are able to switch doctors and switch insurance companies throughout through October and December. Now, with what we call Obamacare or ACA, this was possible with Obamacare because what people were doing was switching around from company to company. So, for example, if somebody was in a one type of Obamacare, 3 months later they would switch to another agent, another insurance, and then switch to another insurance, and it was creating havoc in the community. So the government came up with this open enrollment idea that they were using for Medicare, and patients are able to switch their insurance once a year, and if they're not happy with it, they have a month to change over
Okay.
uh in the month of January to switch over to another company, but that's it. Now, what it does though, it gives us the opportunity to market ourselves with the insurance companies that we're aligned, the insurance companies that we work best with, and those are the companies that we tend to do collaborations with. Um, there are multiple companies out there, but I believe that you have to pick your the one that you feel comfortable with, the one that serves best to the community.
Right.
In I know where your locations in we're Family Medical Group, and as well as my locations in Broward County. Most of them right now, the two biggest ones are the ones that serve us better.
Okay. What are those?
So the first one is Florida Blue.
Okay.
My Blue is an excellent
Right.
insurance,
Right.
very good.
Excited to be with them now.
Yes,
Yeah.
their mental
It's a
health.
privilege. Yeah.
Yes, and it is amazing. Their mental health is benefits are really good.
Okay.
Their weight loss programs are really good. So they're covering a lot of those medications.
Okay.
Um, the other thing that they have is they have not um they have a very selective group of primary care doctors. So not everyone can get into My Blue.
Excellent. So,
So there's only about 3 groups in South Florida that
okay.
are on it, and thank God we are one of them,
Ooh.
and we could serve
That's
Miami
awesome.
better.
Yeah.
If it's very economical,
Okay.
it's very subsidized. Now the other one is Aetna. Aetna, that has a very good um, uh, Obamacare or ACA. Now the difference is that one is a for profit and the other one's a not for profit.
Okay.
So there are decisions in medicine that for-profits organizations or insurance companies will make versus the non-for-profit.
Okay.
So patients should look into that, because the non-for-profits are a little more lenient in what they can approve or the benefits that they will give patients.
Can you elaborate a little bit more on how can a patient switch providers? Because we're getting a lot of feedback that certain organizations tend to tell the patients they cannot switch. So this has become an issue in the communities nowadays.
It is a very big issue, and honestly, we're having that problem ourselves, and we've been in this game for a long time. And it is insane how some patients will call in. I was having a conversation today with an insurance company, how the patient is, they say, I'm not listed in that insurance company. So there are agents out there that are not the most ethical
Okay.
in Dade and Broward and across the nation that will tell the patients sometimes that that group is not in there, and they'll try to place the patient in another insurance for the benefit of their own pocket, and on another, or somebody that's their friend, an office that's friendly towards them, and that's where this happens. But if we get our tax ID numbers and our MPIs, which is the way that we identify our companies and in our offices, we should not have a problem with that moving forward.
Okay. I know you mentioned also expanding to other services like mental health, which is something that FMG will start having as well. What are some other specialties that you, your PMP side, do and that FMG should start doing come January
So
2025?
moving forward, you should look into a cardiologist.
Okay.
Cardiovascular disease is very important. Um, Also, peripheral vascular disease, which is what has to do with the veins. That's very needed. But most of all, we live in a predominantly Hispanic community where 50% of the patients should be checked for cardiovascular disease, and that's a very good specialty to have in house. Also, the gastroenterology. Everybody after the age of 45 should have a colonoscopy. A colonoscopy not only saves lives, but it also um, helps helps close something that we call the insurance gaps, uh, that we have to abide by protocols given to us by insurance companies that were driven by the government and by the CDC and by several organizations out there. So we have to be compliant with that. The other one that I have is in house is my psychiatry.
Okay.
My psychiatry is a group of psychologists and psychiatrists that are on board. That if you are in a remote location, let's say, if the doctor on Thursdays, let's say your Homestead location, which is by the way a gold mine, and I'm so happy
Good
that
to
you
know.
have that location.
Yeah.
Everybody that goes there tells me, from drug reps to specialists that tell me about it, that look
Okay.
at it, you're gonna help so many people there. You're gonna help so many underserved people,
Yeah.
which is going to be amazing. So you're doing a great job of placing these clinics or these offices in great locations. But more important, if somebody needs to see a psychiatrist, and psychiatrists are very hard to get in, and let's say somebody's having a problem with a couple's therapy or whatever mental health issue, you can telemedicine that, and you have a connection from your office to somebody, let's say in Pembroke Pines, that could see them and give them therapy for that hour, and it works amazing. I do it in some of my remote clinics, and it works well. The other specialty that we have is pain management.
Okay.
Pain management is a problem because a lot of these patients that have lumbar, and I feel like you know more about this
Yes.
than I do, because this is your up your alley. Pain management works well. In recent years, the opioid crisis is been a problem. We want to avoid that as internal medicine doctors. We don't want to overwrite or over give pain medications or narcotics. So we bring in specialists that know how many Percocets that person needs or how many opioids is a person abusing it or not, and they have parameters that they go by. So that is something that definitely would work, and the insurance companies love it because you're there, taking care of the patient.
Okay. Well, mental health for us will start now in October 1st. So I will definitely keep you abreast as to how that's going. I will take your suggestions on the telemedicine. I was thinking of doing first in house, seeing how that develops, and then start doing the telemedicine. So we will be just doing the medication management portion. Then we'll be bringing in the behavioral health, the psychology part, and so forth.
And that's amazing. Congratulations on that.
Thank you.
And that's one of the reasons why I partnered up with you, and we're doing these collaborations throughout Miami-Dade and Broward, because of your innovation and your open-mindedness of doing this. And mental health is definitely something that not too many people tackle it. People write off depression like a sign of weakness, which is not right. Depression is an illness, and you're doing the right thing by bringing in psychiatry into your offices.
Amazing. I'm looking forward to
Yes,
serving the community.
absolutely.
Speaking of Homestead, we're actually expanding in Homestead. So we're going into a huge building that we just acquired. It'll have 4,600 square feet where we will have these other specialties in that center. So I can't wait for you to come by and see it.
Definitely look forward to
Um,
it. Yes.
so, in reference to services, I also wanted to share with you. I know that you're also open to now us guiding you a little bit about personal injury and how we can place them into PMP. Are you open to that? And what's your take on personal injury?
Absolutely. Our offices are, as you know, we have 6 locations in Broward County. We're seeing currently about 300 patients a day. One of the biggest things is that a patient comes in and the chief complaint is car accident. In the past, we didn't know what to do with this. The patient got into a car accident, on Saturday night. We're the first person that they see. So we would like some guidance on what to do with these cases because I know that I get subpoenas all the time about, from a lawyer because I was the first one to see it, or I didn't do it appropriately, or I didn't bill the car insurance
Right.
company, and I billed the health insurance. So I'll get a denial from a health insurance, but because I was supposed to bill this to Progressive or Geico or
Yeah.
Allstate or State Farm.
Yeah, you definitely have to. The car insurance always takes
Correct.
favor, and that needs to be built first. Anything after goes through the health insurance.
Absolutely. And those are the things that I'm not my knowledge in that is very limited. And I love the fact that you guys are very knowledgeable. And so we have to learn a lot from
Yeah.
you. And we look forward to doing that.
We're looking forward to collaborating with you and putting these services into your locations so that you could better treat your patients as well. And that way we could collaborate and cross reference patients when needed, depending on the services that we can give them.
Absolutely. Absolutely.
Tell me what's a step by step on how you see your first patient?
So the most important thing that when you're seeing a patient is that you should collect data from the patient, right? You should ask the patient, have they been hospitalized? Number one, have they seen another? Who was their primary care doctor before? Who was their specialist? Gather all the information that you can. Have they been in the ER recently? There is a website that we have as providers called the ES system, where we know when a patient went to the emergency room the day after. So at 8 o'clock in the morning, that gets updated and it gets updated at 6 p.m. That way, you know which patients were in what emergency rooms and whatnot. So, with that in mind, you look up the patient. You also e-force the patients to see if the patient has received any narcotics or any benzodiazepines, Xanax, Valium, and whatnot. So you're gathering as much information that should be done before the patient even gets there,
Okay.
with the permission of the patient. And that's why you send them a new packet. I notice that you have a great system of doing this where you're communicating with the patients beforehand. And one of the things that you have is a consent. A consent form will give you the authorization to gather all this information. Once you have all that information in place, you see the patient, you the physician or the mid-level will see the patient, gather all that information, and see the needs of the patient, and gather all that, put together the information that the patient is giving you with the information that you gathered the day or the morning of. With that said, there are a lot of things that we as physicians miss. And you're a nurse, so you should
Yes.
know this. There's colonoscopies that we miss. We miss vaccines. Vaccines are very important. Cervical cancer, very prominent. Obesity in our population, the Hispanic population here, is something that Homestead has like a 70% obesity rate. It's something that is very well known, and we tend to ignore it. We tend to rush ourselves through the first visit, and that's the worst thing that you can do to a patient because the first impression is the best impression, right?
Correct.
And that might change their outlook. This person might be scared. Some of these patients are patients that haven't been to a doctor in 10 years.
Oh,
You got to hold their hand. The first thing that you should do, take their pulse. By taking their pulse, you're touching the patient, you're communicating with the patient.
I love that.
You
Okay.
know,
Yeah.
you grab them. That person might be married. That person might be in a relationship, but that person maybe have not has not been touched in 24, 48 hours. By you putting your hands there and checking that heart rate, they feel like you're communicating with them.
Building that rapport.
Look
Yeah.
at them eye to eye. Forget about the laptop. We as doctors look at the laptop. The laptop is our worst enemy when we're communicating with patients. Look at them in the eye. Make the connection. Once you make that connection, patients are going to feel like they're part of you. You don't stand up and talk down to the patient when the patient is sitting down.
At eye level.
Eye level, make them feel like
Yeah.
you're not anymore. You're not more important than that person sitting across you. You're the same. You gather all that, then you say, okay, you know what, Mrs. Jones, we're going to do your blood work today. We're going to check your heart. We're going to do an EKG. And you try to do as much blood work as you can, even if they're not fasting, because there are levels of triglycerides and levels of cholesterols that doesn't matter that you're fasting or not. You could gather that information at 2 o'clock in the afternoon. You have the patient there. Don't lose that opportunity of checking that thyroid.
Yeah.
Thyroid doesn't have to be fasting.
That's a common misconception. To always be fasting, correct?
Yes, one of the things that irks me is when I'm walking through my one of my front desks, let's say one of my offices, and the patient they'll tell the patient, somebody in the front desk will tell the patient, "Oh no, we can't do the blood work because you're not fasting." Listen, there's only one blood work that is truly has to be fasting, and that is the lipid or the cholesterol panels. And only one thing out of the cholesterol panel is the triglycerides. That's one thing. So try to get as much information by gathering that information, collecting the blood, doing the EKG, and then saying, I want to have a follow up visit with you. During that follow up visit, you want to say, Ms. Garcia, look, um, your triglycerides were high, your thyroid was high, um, you're a little bit overweight. You don't want to go into the chase of the overweight right away, because some people take offense to that
Yeah.
unless they bring it up, obviously. But you want to talk to them on the second visit and tell them, hey, we have programs that we can put you on. You know what? You're becoming a pre-diabetic. Maybe we can get Ozempic or Manjaro on.
Yeah.
If your BMI is over 35, you know what? Maybe there's Zepbound that we can give you, or Wegovy that we can prescribe you. And you want to make the patient feel comfortable, but you also want to make them part of the decision. You don't want to say, hey, I'm going to put you on this and that's it.
Yes.
If the patient, is a little bit reluctant, you say, hey, this is why I want to do it, because the cardiovascular disease or heart attacks are common. And this is but you know what? Let's wait 2 months, 3 months, and let's see if you can change this. If they don't want to take the medication right away, let's see if we can get better in 3 months. In 3 months, I want you to come in. We'll repeat the blood work, and then I'll see you again. You also have the conversations about vaccines. Like I said, HPV is very rampant. HPV now has an approval from the ages of 11 to all the way to age 45.
Wow. They've
So
expanded that. Okay.
yes, very, and guess what? Cervical cancer is common. Throat cancer is common. There was an actor named Michael Douglas who had throat cancer, and
Linked
it
to
was
HPV, correct?
yes.
Right.
And when you talk about a celebrity having cancer, patients look into it a little bit more. So yeah, offer them the shingles vaccine is also important. The flu vaccine is very
Yeah.
important, and those are things that we as physicians, because there's a huge list, we should take care of it in 2 visits. But more or less, that's what taking care of a new patient it
Okay.
takes.
What are some of the most common chronic conditions that you treat?
So the most chronic condition that I see, believe it or not, is back pain.
Okay.
Yes. Back pain is the probably the number one reason why people come in.
Is this where
Back
the pain management comes into?
No, most back pains go away by themselves.
Okay.
Most back pains are muscle spasms. So you got to look at the patient, examine the patient, stretch out the patient a little bit too. And most of the times with good anti-inflammatories and good muscle relaxers, the pain will go away. A shot of Toradol or an injection of Toradol is very effective. Uh, an injection of dexamethasone is also very effective, or a Medrol pack,
Okay.
a Medrol dose pack, also very effective. And you bring the patient back 3 or 4 days later. Most of the times they don't come back because the pain went away. And so that's the number one probably visit. The second visit is GERD, gastric reflux
Yes.
disease. Gastric reflux disease is very rampant. It's worse on patients that are obese. Third, I would say, is flu, and the other one, believe it or not, is cough.
Okay.
Okay, and cough is very interesting because cough can come from allergies, or cough can come from gastroesophageal reflux
I
disease.
don't think people know any of those two. They assume a cough is either asthma, which asthma is related to allergies,
Yes.
but they assume that it's a cold most of the time.
So a patient comes in with a cough that's been lingering 3 or 4 months, and they receive, let's say they receive, I went to an urgent care and I got antibiotics and I got this, and now I have this cough. A lot of the times, this is an allergy.
Yeah.
Should test for allergies. I know you do well with allergies,
Yes.
and that's very innovative, actually. And I think that we have to applaud Family Medical Group for that,
Yeah.
for having allergies in place, because most doctors overlook that, and most doctors don't look at it as what we call a disease or a condition. But most of these coughs come from allergies. Patients have a postnasal drip. Postnasal drip is very interesting because you might not feel it, but it's just a constant drip of your sinuses, um uh getting, becoming humid and wet, and then dropping into your throat, and that's what causes the
The
cough.
cough, okay, and the
Yes.
HEIs, okay, right.
And then there in the bottom of the list is the person, the 35-year-old guy that comes in and says, "Hey, I got married. Now my wife is pregnant and she's making me come in for a physical exam." So those are the ones that we see a lot. I've been
Yeah,
seeing a lot of those lately, especially around, the holidays. People,
yeah,
yeah, found out that they're pregnant, and they send their husbands to
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 get
get
checked
checked out.
up.
Yes.
How often are the follow-ups?
So for diabetics, so which is very common, 50% of our patient population now is considered to be diabetic in the United States. Locally, it's probably running around the same. Diabetics should be followed every 4 months once they're established, once we have their medications in place. If we're starting the medications, we should do the medications. Um, it's going to be more close up visits until we get it figured out. But most of the times it's 4 months for blood. What I usually do, Liz, it's I do 4 months blood, 2 weeks later with me. So 4 months the
Okay,
labs, and then 4.5 months with me. And that basically, I get to keep an eye on the patient 3 times a year. That way you're checking the kidneys, because the diabetes affects the kidneys,
right.
and so you want to keep an eye on that, and you want to keep an eye on the thyroid. Diabetes, most patients with diabetes will tend to have or will have a thyroid problem because it's in the autoimmune disease
Family.
group.
Mhm,
So it is common.
okay.
Um, and so it's something that should be checked out.
So if you don't have any acute or chronic conditions, usually 6 months or a year follow-up is
I
required.
usually do a 6 month follow
Okay,
up on most patients. If it's anyone from the ages of 18 to 35, I'll do it once a year. And it's important to send these patients reminders, because these patients will not remember, or let's face it,
yeah,
it's not the most enjoyable visit,
it is
right? There's
not.
there's 100 things that I can think of that better than going to a doctor or a dentist, right?
Correct.
So you want to remind these patients. You want to have a system in place where a good electronic medical record that will remind you and say, "Hey, this patient needs a visit." Let's send them a text message. Now we
Yeah.
live in the era of text messaging
Yes.
and emailing, and it's really important that when the patient comes in, you web enable them.
Thankfully for these EMR systems because
Yes,
it's a lot of work. And now with all the new advanced features and AI, it makes it so much easier for us to stay on top of them and get the reminders in.
it does, and sometimes we feel like it creates more work, but I think it's more efficient work.
Correct. Correct. Okay, Dr. Isa, thank you so much for joining us in the Liz Hustle and Heart podcast. It was a pleasure having you. I look forward to doing another series soon.
Definitely. I mean, congratulations. It's a
Thank you.
beautiful place. Uh,
Oh, this is not
and
mine though. It's Roger's.
and congratulations on Family Medical Group. You're doing an excellent job.
Thank
I
you,
look forward
doctor.
to working together with you. And your locations are awesome. I love your waiting rooms. The
Amazing.
front desk is always happy, always
Giving out snacks
amazing.
and smiles.
Yes.
Thank you so much,
No,
doctor.
thank you for having me.
And that's a wrap for today's episode of Hustle and Heart. A big thank you to Dr. Issa for sharing his wisdom and experience with us. It's always so inspiring to hear from someone as dedicated to the health and well being of the community. If you enjoyed this episode, be sure to subscribe, leave a review, and follow us for more insight and conversations. Until next time, keep hustling with heart.